Lean Healthcare Management Projects by Jessica Dent. What is lean in healthcare? Many of you have probably heard of the lean method. Specifically for lean in healthcare, it means driving out waste so that all work adds value and serves the patient's needs. Types of waste in healthcare: defects, overproduction, transportation, waiting, inventory, motion, and overprocessing. These types of waste can affect all different departments in the hospital, whether it's physician-based or administrative-based. Where did the lean method originate? Lean methods and thinking can be credited mostly to Toyota's owner, Sakishi Toyoda, who basically looked at the production of Ford's cars and found the problems in it, and he then created the TPS, Toyota Production System. His development of ideas in reducing waste and producing better products quicker later became known as lean. Why use the lean method? Using the lean method in hospitals can help cut cost, eliminate medication errors, improve patient satisfaction, reduce the time patients are waiting around the hospital, create more time between patients and their physicians, and much more. Examples of lean success in healthcare. According to a study, emergency room employees at 9 Northern Virginia hospitals use lean principles and practices to reduce emergency room waiting times. The consortium reported a 31% drop in average waiting time and a four-fold reduction in the number of patients who left the emergency room without being seen by a medical professional. Examples of lean success in healthcare. Charles Lukey, a consultant for Washington Manufacturing Services in Mukilteo, Washington, stated in a journal article regarding lean healthcare. A good example of flow occurred recently with one of my healthcare clients, Yakima Valley Memorial Hospital. During morning rounds, physicians would leave charts on the unit secretary's desk. The unit secretary would read the chart and enter the orders. A fine process, but orders come in two varieties, stat and routine. If the unit secretary was at the desk when the physician approached with the chart in hand, the status of the order could be quickly communicated. This is stat. The unit secretary would then enter the order while the other, presumably routine orders, stayed on the countertop waiting their turn. But what if the unit secretary was not at the desk? Asked Lukey. Should the physician put the chart on top of the pile? Should the physician wait? Should he inform a nurse? Yakima Valley Memorial Hospital addressed this problem with two rolls of electrical tape, one red and one green. The tape was used to make two squares on the countertop, one marked stat and the other marked routine. Whether the unit secretary is at the desk or not, the physician places the chart on the appropriate square, and the status of the chart is clear. When the unit secretary returns, they know that this chart is the stat square and must be entered next. Lean projects I personally have created, Part 1. One small lean management project I implemented in my emergency department was moving the code cart from the front of the emergency department to the center. The code cart is used for various things, mostly for suturing. My thoughts on moving the code cart was to eliminate time wasted. The code cart is shared throughout the whole ED. If you are way back in the ED, the code cart is far away from you. Therefore, time is spent wasted by walking to the code cart. By moving the cart, I was able to lower the average time wasted walking to the code cart in my emergency department. If you look at the picture on the bottom left, you will see a little layout of my emergency department. Our emergency department is split up in between care teams. There are 6 care teams. Care Team 1 was the original location of the suture cart. As you can see, Care Team 1 is at the front of the emergency department. Care Team 4 is in the middle of the emergency department. This is the new location for the suture code cart. The second half of my code cart project was swapping out the code cart for a new one. On the bottom left, you will see the old code cart. There were multiple items not related to suturing and things that did not belong in the code cart in the original code cart. You can see all of the stuff on top of the code cart that is also not related to what a code cart is made for. Each drawer of the code cart was also simply labeled suture cart. There were no labels on the drawers, so there was no telling what was in each drawer. On the bottom right is my new suture cart. I took a dresser that was in the emergency department that was empty, and I moved all of the belongings of the old suture cart into the new one. This one is 5 drawers. I also labeled each drawer with the belongings that were inside of each drawer. I was hoping that this would again help eliminate time wasted. The physicians would be able to find things that they needed quicker because the drawers are labeled and it is organized. How to start implementing Lean into your healthcare. First off, spend time observing your practice. Find the areas that need improvement. Some questions you may ask yourself. Does the practice value the patient's time? Have effective means of communication? Have minimal wait times? Offer appropriate follow-up? Meet the patient's physical and emotional needs? Exceed the patient's expectations? Offer adequate face-to-face time? Conclusion. Lean healthcare methods have a proven track record of improving quality of care among patients in many hospitals. Implementing Lean methods can be a challenge. If you are looking to bring Lean into your workplace, consider the questions in my previous slide. Try to see what the patient sees. Start small, record the data, analyze the data, and keep trying.